prescribe certain medications that are going to be made by pharmacologists. If you're suffering from maybe depression, anxiety, or schizophrenia. With this said, I would like to invite my brother to come and take on presentation on the relevance of anatomy in anthropology.
Good afternoon. My name is Justin Matadisolungu, a third year student at Apex. So my part of the presentation talks about anthropology. So I'm gonna give you the ins of how anatomy assists in studies in anthropology. So what is anthropology? So don't let the name trick you. Anthropology is actually the study of humans and their ancestors. Anatomy can be applied in different areas such as physical anthropology, which looks at observing fossils that have been discovered by archaeologists. And then the other area is forensic anthropology, which helps to prime investigators to establish the cause of death of on fossils that they discovered without uh, clear cause. The other aspect is bioarchaeology. So bioarchaeology looks to discover and study the fossils and the chemicals that exist in our environments. So understanding anatomy helps scientists to look into human evolution and into the variations and also how species adapt to varying conditions and lastly the cultural practices. With that said, uh, here are some implications of anthropology. So as I earlier stated, for human variations, so like morphological variations that exist between different beings of sometimes different species, but or similar species, but the variations are vast, and it is through anatomy that we're able to establish this. The other application is on adaptation to the environment. With that said, now I'll take you into economics. So what is economics? Economics, this is a branch in science that looks at optimizing the work and interactions of individuals with the furnitures or resources that they come across. So what you notice is that economists are needed in a lot of fields in constructing the furnitures, the couches, the tables that people use in offices, like even the table setting is done by the ergonomist to optimize the functionality for the individual. So what do ergonomists look to do? They try to reduce the number of injuries that occur and try to increase the productivity and the sustainability of the employees. And it looks for the health and of the individuals so that they can be free of any pain and also to increase their morale as they carry out their work. So here we have pictures that illustrate certain areas where an ergonomist has made an influence. So like first table, on the first picture, we have a man that looks very happy seated in his car because the ergonomist did his job in optimizing the environment, allowing him enough room to be free, but yet easy access to the resources. So everything is within reach. The second picture just below is we have a lady who is seated comfortably on a chair that's been well designed to optimize the back pressure so as to reduce strain with the back. And on the feet, she has a footstool so that it can help get ground. And the setting of the computer as well has been placed in such a way that it will optimize the visual for the individual, also reducing the effects from the backlight from the screens. The second picture, we have a scissors that's been specifically made to fit the right hand so that it can allow people who are utilizing it to use it for longer. With these few points, I shall go into my next presenter, Mrs. Tembo, to come and help us with it.
Um, Good afternoon, viewers. My name is Natasha Tembo, a PhD student at Apex. I'm going to present to you a topic called aesthetics and cosmetology. These are related fields of study that focus on enhancement and improvement and to maintain our physical appearance of the body. Anatomy plays a crucial role in aesthetics as it plays and provides a foundation on understanding the body structure and functions. I'm just going to mention a few in which anatomy plays a role under our topic today, and aesthetics and cosmetology. The first one is facial aesthetics, facial symmetry, and proportions. Understanding the anatomy of the face is crucial as it allows the professions such as aesthetics and cosmetologists to identify the ideal placement of injectables such as lip fillers, lip plumbers, and botox, so on the list. I'm going to give an example of a client who has, or sorry, I'm going to give an example of a client who wants to reduce the facial wrinkles. An aesthetician needs to understand facial anatomy and the muscles, in this case, frontalis, the muscle frontalis, yes, the muscle, frontalis muscle, for them to be able to do the procedure well. I'm going to go on to the next point, which is skin health and aging, as well as skin health and care. The skin is the largest organ of the body, and it is crucial in cosmetology as well as aesthetician. It is important professions such as dermatologists and aestheticians and professions that I cannot mention right now to know the layers of the skin, its contents, and its anatomical makeup for there to be efficient development of proper skin products as well as proper skin treatments. I'm going to give an example as well here of a client who has acne. It's just a clogging of our skin pores, redness, so on. It is important for dermatologists especially to know the makeup of the skin, skin types, and different skin tones and how they respond to different skin treatments and skin products for that to reduce the damaging of the skin in general. And I'm going to go on to the last point, which is hair growth and health. As hair professionals, it is important to know the anatomical as general knowledge about hair follicles, hair growth, and hair cycles, for that to be effective development and effective development of treatments, hair products, and so on. It is important for hair specialists to understand the anatomy of hair in order to develop such products to reduce scalp conditions, to reduce hair loss such as alopecia. I can go on with the list. I'm going to give the last example of hair growth and hair health, which is a hairstylist. A hairstylist should be able to identify different hair types, different hair textures, for them to be able to do certain activities in their job or work, such as hairstyling, hair coloring, and as well as to be able to advise the clients on how best to keep their hair. With these few points, I'm going to go direct to our conclusion of our topic, which is anatomy beyond muscles and bones. Anatomical sciences part apart in the study of muscles and bones, underpins advancements in biological engineering, radiography, sports anatomy, neuroanatomy, ecology, aesthetics, and cosmetology. Disciplines enhance technology precision in diagnostics, athletics, performance, understanding of the brain, insights into human evolution, improvements in physical appearance, collective demonstration, and vast scope of anatomical knowledge. This marks our end of our presentation, and I would like to thank everyone in this room for attending, as well as the viewers out there. Thank you.
Excellent. Thank you. Presenters, job well done. I would like to invite back to the floor Professor Oberton to give us a brief summary before we move on to roll call. Professor Oberton, the floor is yours.
Thank you so much for your time. I'm very convinced that after the presenters have made their points, they have been able to register something new in our minds beyond bones and muscles that are not anatomy goes beyond that. And a lot of people who have always thought anatomy to be a science of only the dead and bones and muscles, with this few presentation, we'll now begin to view anatomy beyond that. I want to thank all of us for the time we have spent, and I'm sure we'll have some more time to spend together during the question and answer section. Thank you.
Excellent. Thank you, Professor. Now, I would like to do a quick roll call before we begin question and answer session. Please, by show of hands, and you can also write in the comment section, how many of us are listening from any of our main campuses? You can simply show by a raise of hands, and you can also comment where you are listening from. I see we have a number of hands from, unfortunately, I cannot read out these usernames as these are a lot of numbers. So I will only call out the names written. We have Moses. We have Professor Emaus. Welcome. We have Kent Mushota. We have Bongi, Candy, Chalwe, Mwelwa. Excellent. We have Oshita. Excellent. In the comments, we have a number of students listening from our main campuses. We have Vanessa. We have Kimberly, Anna, Brian, Richard, Joan, quite a number of you. Excellent. Well done to all of you. Hands down, thank you. How many of us are listening from any of our Kitwe or Kawe sites? Once again, by show of hands, as well as in the comments. How many of us are tuned in from Kitwe or Kawe sites? We have Ricky from Chongwe. Welcome. I believe Mulenga is from one of the Kitwe or Kawe sites. Namushi. We have King from Chingola. Excellent. Do we have any more from Kitwe or Kawe sites? We have Kunda from Ndola. Excellent. What about those from the clinical placements, such as Levy or UTH? We have Kingster from UTH, welcome. Do we have any others from UTH or Levy or any other placement sites? Please note that for those of you in the comments who are sharing your location, home, please indicate which area that is in. Thank you. We have Victor from Kabwe. Excellent. First of all, I'd like to appreciate those in attendance. We are standing at 258 participants, so well done. All right. We have Beatrice, UTH, the Ridgeway campus. We have, unfortunately, there's no name indicated here, Chilenge, Level Hospital. Excellent. We have another from UTH. For those of us in attendance, afterwards, please take note to change your username within Zoom. Please change it to your professional names. It would be easier to use in future Zoom meetings. Some of the names indicated are numbers, so that would be quite a challenge to pronounce. Thank you. Moving forward, the floor is now open for question and answer session. House rules, if you have a question, observation, or anything else to share, please do so by raising your hand. The floor will be given to you, or you may write your comments in the chat. We have Professor Kasolo listening from Addis Ababa, Ethiopia. Welcome. So, question and answer. So, question and answer session is now open. A reminder for those of us in attendance, this is an open platform. This is a chance for you to learn, to share information. Not only are our presenters learning, so are you in attendance. This is a platform for sharing information. So please, the floor is open. Once again, please stay muted unless the floor is given to you. I see we have 3 hands up, but I believe these are from placement site responses. Professor Emaus, you have your hand up? The floor is yours, madam.
Hello? Can you all hear me? Hello. It's very nice to be back in the ground round again, and also to be back at Apex for just a brief visit. And it was with a great pleasure I could listen to this presentation. I found it very interesting. And I just have a small comment or question, or yeah, maybe not a question, but a comment. So I really appreciated the lecture and the way you are expanding our understanding of the importance of anatomy. Me being basically a physiotherapist, I liked the way you talked about the cruciate ligament and its function, and I would also expand that the general total anatomy of the body is so important when it comes to sports and sports anatomy, because it's also on are you long-legged? Are you what kind of sport fits for you? And of course the physiology is very important, but like why do we have the excellent runners from Ethiopia, from Kenya? Is it their lung function, or is it their long legs? So why are why do we have the excellent short runners and the long runners, and that's all also back to a lot about anatomy. So I just wanted to expand on that, and thank you for a wonderful presentation. I will try my best also from Norway to listen to the grand rounds, but it's not that easy, but thanks a lot.
Thank you.
Excellent, thank you. Oh, my apologies. I had a slight challenge unmuting myself due to the high number. Thank you. Thank you, Professor Emaus. For those of you who are listening, due to the, if I can say, the noise cancellation, those of you who are looking at the Grand Round team, they are applauding, but unfortunately, due to noise cancellation, we can't hear their applause, but there was one. So thank you for that. All right, we have Aurea. Please, the floor is yours. You may take the floor.
Okay, thank you very much for letting me have the floor. Mine is a contribution. I want to applaud the speakers who have today shown us the important role that understanding anatomy can play in other fields like biomedical engineering, medical imaging, etc. It's really nice to see them talk about these things. In anatomy department, University of Cross River State, Nigeria, where I currently lecture. A couple of years back, we looked at the curriculum of anatomy there, and we decided to rejig it to broaden the prospects of our BSc anatomy graduates. And so we included a lot of other courses like prosthetics, biomechanics, aesthetics, and cosmetology, just like we've seen today. And incidentally, Professor Obeten happened to be one of those that was in the team that looked at that curriculum change in our department. So I want to also thank him for creating this awareness in the student all the way in Zambia. And once again, thank you for having me.
Thank you. Thank you, Dr. Aurea. And you are most welcome. Before I move on to the next question, I would like to acknowledge the presence of another guest from South Africa. Please correct me if this is Dr. or Professor Ramokogopa. Forgive my pronunciation, from South Africa. We also have Dr. Oshita, Unicross, Nigeria. Once again, question and answer session is on. The floor is open. There are no right or wrong answers. This is where we come to learn and share. We have one from Jeffy. How do you treat plantar fasciitis in relation to anatomic and muscles?
Thank you for the question that you've given us.
I would like to answer by saying you can treat plantar fasciitis in relation to anatomic and muscles by relaxing.
Effie, I hope this answers your question. Once again, the floor is open. Again, to Jeffy, if you still have any more questions, please feel free to ask. I would also like to acknowledge. Oh no, my apologies, the name has disappeared. We have quite a high attendance, so this is excellent. Here we are. We have, once again, please correct me if this is Dr. or Professor Etukundo from Kampala International University, Uganda. You are most welcome. Jeffy wrote further, can he explain further on the treatment? Presenters, could you further explain on the treatment?
Okay, so to further explain on the treatment, when I say you can treat plantar fasciitis by relaxing, I meant by relaxing the knee joint. I don't know if that is clear or not.
By relaxing the knee joint. Jeffy, please give us your feedback on that. Until then, do we have any other questions or comments? We have a few comments from earlier on. Costern says, wow, so impressive. We have a Samsung saying, congrats to Professor Obitin and the entire anatomy department for this inaugural presentation. This is really impressive. Well done. iPhone says, organized and impressive. We have a number of comments, well informed, super proud of my colleagues. Thank you for this informative presentation. This was powerful. All right, we have new comments. We have from, once again, if you're a professor or doctor, please give me a moment. From Etukudo, most of the anatomical models used in medical schools are produced by artists. These models lack many surface markings due to the lack of in-depth knowledge of anatomy. Anatomists can produce the models used in medical schools and consider all the surface markings necessary for quality delivery of anatomical knowledge. Jeffy says, thank you, well understood. We have one from a Madam Catherine Zulu. She has 3 questions. The first one, what are the key differences between X-rays, CT scans, and MRIs in anatomical imaging? Presenters, I will give you a chance to answer before I read the next questions. Shall I repeat?
Please repeat the next one.
All right. The first question, what are the key differences between X-rays, CT scans, and MRIs in anatomical imaging?
All right, so the differences between those ionizing radiation is that X-rays and CT scans and MRIs are used in different body structures. The most common structures that are used for X-rays are the examinations of bony fractures, broken bones, that mostly operate with X-rays. CT scans aimed at understanding it has mostly been used on making diagnosis on the abdomen. Yeah, mostly that. The MRI also deals with the heart.
Excellent. The second question. How does radiography assist in diagnosing bone fractures and other skeletal injuries?
Okay. How does radiography assist in diagnosing bone fractures and other skeletal injuries? From viewing those internal images, when they are appearing on X-rays, the bones are appearing to be on the images that are being produced from X-rays. When the bone is broken, they will appear different. Okay, so let me take that one again. When viewing those images on the X-rays, the bones will appear different from their normal structures and tissues. That's when you can be able to tell whether the bone is fractured or even damaged.
All right. Third question. What safety measures are crucial when performing radiographic procedures?
Just tell them it's beyond.
Okay, that question is beyond anatomy. That should be directed to the radiography field.
Yes. Thank you. Madam Zulu, I hope this answers your questions. Once again, please feel free to give us a follow-up in the comments. Before I move on to the next question, Turnwell, please, you have your hand up. The floor is yours.
Okay, thank you. I wanted to just appreciate this presentation because it was really resonating with me. By the way, my name is Turnwell Kenalemang. So I'm a third-year student from Apex University, and I'm also doing a degree in neuroscience and also a degree in public health. So one thing that I always do is that since I'm a neuroscience student, I've found mentors in the neurosurgery field because it is something that I really like and is close to my heart. So I spend most of my time at UTH with the neurosurgical team, like the professors of Dr. Sichizia and the other neurosurgeons. So I've really learned that, anatomy is very vital and crucial, especially in the field of neurosurgery, because I used to go there and attend their morning sessions whereby they will come and then present their cases, and then they will be asked questions and so on. And something that really struck me was that for you to be a good neurosurgeon, you really need to know your anatomy. And as I was doing my first year, I was like, I'm really struggling with anatomy, but these people are still learning the same anatomy that I'm still doing. So I really learned that, anatomy, it is really imperative as a doctor, as a surgeon, and as you go on to specialize in your various fields. And I remember one moment whereby I was allowed to witness a transfemoral surgery whereby they were removing a brain tumor through the nose. And throughout the whole surgery in theater, they were really emphasizing on the anatomy, like all the way from the nasal passage, how you insert your endoscope, how you pass through the sphenoid sinus, how you open the cellar, and how you remove the tumor. And it was really a nice experience to really know how anatomy is really imperative into this field. So I also wanted to like stress out to my colleagues here that, you know, they should really take it serious, because even when we go to our clinicals, it will really be it will be a really vital thing that you have to know, because if you don't know your anatomy, I don't think there's a good doctor that can treat patients without the anatomy. So that is one thing that I wanted to add about, you know, my experience, you know, doing the mentorship program with the neurosurgeons, and also learning, you know, the aspect of anatomy and stuff like that. But then my question was that, is there a program here at Apex whereby students are given like maybe mentorship programs or something along those lines to explore more on other fields? Maybe let's say, like for example, we have Professor Oberton who's doing anatomy. Like, is there a program whereby he can choose to mentor students, or students can approach him for mentorship and stuff like that? Like, does Apex provide that kind of spectrum? Thank you.
Thank you for that question. Apex is already working on something to start a postgraduate studies in anatomy. That alone is a specialized area of anatomy, and those are open for short courses and diploma certificate courses in related topics. So the management of Apex is already on top of it. We are just waiting for approval of start, and very soon the university colleagues will be well informed about that. Thank you.
Okay, thank you, sir.
Excellent. Thank you. We have feedback from Madam Catherine. She says, thank you, well understood. Moving on. We have one from, is this the condition that causes pain and inflammation in the plantar fascia? Clarification on the question. I might have a comment if so.
Madam Shalom, can I say something?
Yes, welcome, Dr. Chimba.
Yes. Prof. Oberton, thank you for this inaugural presentation. Yes, I was listening very intently and excitedly as each presenter came in with new thing after new thing. And my favorite is him who spoke about sports medicine, and as he talked about sports anatomy and enhancing performance, I was just thinking in my head about Mozart. And I'm like, yeah, he's making us proud as a country, and I think he needs to come and see so that he can even perform better going forward. But just a few reactions to some of the things that have been spoken. Number one, there was a talk on pneumonia and pleural effusion. Yes. So if probably before I come to that, anatomy, and when you begin to learn anatomy, one of the things that is important is terms, the anatomical terms that you learn, isn't it? You put your cadaver in that supine position, and whatever you're going to describe will actually be related to your references. It's very important because those terms that you learn, medial, contralateral, ipsilateral, I've heard many people talk about different terms just now. Even now, someone was saying plantar fasciitis. Just by the word plantar, you know it's in the bottom of the foot, isn't it? So those terms, keep them. Because when you come to the clinical setting, those are the terms that we use to describe. So they're anatomical, but they're also very logical. So we need to make sure that we learn them very well. And because that's what we're going to use it as it comes. Supination, what is supination? What is pronation? All that, they're very important. And when you want now to describe the difference, for instance, between a pneumonia and the pleural effusion, anatomy will tell you that pleura is the covering, isn't it? You have two layers of pleura covering the lung, and it can happen from an infection through the lung, it can happen from anything, cancer, whatever. But what happens is that space is a potential space. There's no space there generally. But when there's a disease, that space becomes enlarged because there's fluid now that is accumulating. So anatomy and the knowledge of radiographic cells will actually tell you that this is you'll be able to tell just by certain things that you do on examination, a percussion, you'll be able to tell the difference that this is actually a pneumonia because there's dullness this way, and this is a pleural effusion because the dullness is like that. But then sometimes it's difficult. So you use further anatomical knowledge to actually know that, no, when I listen, one is further away because there's fluid and the other one is near the base of the solid. And also, that one that was showed that there was an angle there between the diaphragm and the wall of the chest. Did you see that? So pleural effusions will not move orbitally, that it's a fluid, and fluid will take up the shape of whatever it is. So the pleural effusion actually orbitally that space and will not be able to see. But with a local pneumonia, it will take the shape of whatever lobe it is that has been affected by the disease. I thought I should just clarify that for sure, the things that you study now are going to be useful when you come to the clinical site. And then just something short on plantar fasciitis. So plantar is what? So again, we're just using the words, even if you don't know. So if you just get we used to use dollars in our time. I don't know what dictionary we use, but we used to use dollars. If you just know your words, sometimes even if you don't know what that particular term means, just from the words you'll be able to interpret. So plantar means at the bottom of the foot. Fasciitis means inflammation of the fascia. So there's actually a band tissue between the heel and the toes, isn't it? It's called the plantar fascia. So that thing gets inflamed sometimes, especially in sports, people with sports med, and also in the people who are obese. Not well understood, but it causes a lot of pain. And sometimes if it's not taken care of, we can actually end up with a chronic condition. So of course, there are various things that people do, especially we have therapists on the core. They come in handy when we're talking about such a condition. But medically, we also take, because it's not well understood, and sometimes we do all sorts of things to try and make it better. Some of the things are the same things that they were talking about economically. How do we make sure that that limb is resting in a position that will make the pain less? So I think this is where now the dependence on basic sciences comes in again. Of course, medically, sometimes they will give injection of steroids. That does help. But the truth of the matter is that it's very important to understand anatomy, because even the type of shoes that the doctors will prescribe will also matter, so that you are able to take care of that. Yeah. So I stop on and on. I thought that I should at last talk about aesthetics and cosmetology. That we think it's an important part of the modern world, especially people who are famous. They want to make their nose look better and things like that. And so I think again, this is an area that you can explore. We can prepare cosmetologists to before they watch more and more things. Yeah, I think that's it for us here. Thank you.
Yes, thank you very much, moderator. I was actually recently surprised when I heard what is connected to cosmetology, like Chimba said here. And I was noticing at the graduation ceremony last time that girls had bought eyelashes to cover the graduation ceremony when yes, they are done. Then I was also told that the boys who cannot find the beard, they also buy them. And most importantly, we are here that people can make money, and they are now selling bottles which can be used in the night parts. I don't know what is true. Yes.
Yes,
But
thank you.
also photos, students, pictures.
Excellent. Thank you. Unfortunately, in the interest of time, I will now have to take just one or two more contributions from our professorial team. We're almost at 14 hours.
Yeah, thank you. May I come in, Madam Simondo? First of all, I want to thank IT team and yourself for having connected international participation. That is very, very good. Professor Nina, based in Norway, she's always an active participant. I'm very happy. Then we have Dr. Rademene Obia from Nigeria. Well appreciated. Very good. And so I said, thank you very much. And you are actively participating. That's what we want to do. And it's a program in Uganda. That was in touch. And also I made of the neuro surgical breast at UTH, he was explaining the importance. And that is extremely important. I will comment on that. But the other question I want to try and explain, there was a question of X-ray, CT scan, MRI. Now, I want to say that X-ray, for example, if there is a depressed skull fracture, now operates anatomy, please try teaching the students to know that the skull bone, as it's not a water the and the inner describing all the layer. So that if you do on this fracture and you share, there are no neurological signs. In other words, the more your joint is not been affected, there's no quality to become one. Which support the right side. That's why we are putting on the right side. Because the dominant brain on the left, the cerebral here on the left side, control the right in majority of people. And there are left-handed people whose dominant brain is on the right. But remember the bigger section point in your anatomy, the motor cortex, how the lumbar tract is formed, and how to pass it through the basal ganglia like that. And the normal like that is not a deep so follow that line. Go down to say, pain paralysis on the left of the arm, try to understand. Going. So for X-ray, if you do an X-ray, and there are clinical signs, you don't be breast cancer. X-ray is good enough. Don't ask for CT scan. You are causing expenses for nothing. X-ray will make you be able to put that and you will find breast cancer. Probably you find the dura mater is still intact. At UTH, from 1991, October 16, 1991, when I was starting to establish neurosurgical unit at UTH, we didn't have a CT scan. We only have X-ray. But we were also using room 10 UTH, a machine which would consider X-ray, carotid angiography. Now here we're mentioning deliberately Here, central nervous system is being diagnosed using cardiovascular system. Because we're using a contrast in the common carotid artery to see how the blood vessels are intracranial. And we will tell that this collection of either stroke or subdural hematoma is connected in such a site, looking at the position of the blood vessel. We were using carotid angiography, and we did not see much in terms of missing diagnosis by that procedure. Then later on, we had the CT scan. Can you plug the UPH over question? The almost completely done in there now. And it will be very good. CT scan, we can show the detail of what has happened in the head. So your diagnosis, your measurements, you have to define how we are going to open the ring and dealing with the brain too. Meaning, for example, MRI. When do we choose CT scan? CT scan is, in terms of cost, is much less than MRI. So unless you have failed to understand on CT scan, when you order MRI, it's a very expensive investigation to do. You have to be selective. The advantage of MRI, it gives you more detail than the CT scan. You will see it as you go to clinical area. But start understanding why do clinicians choose this and this and this. Certain things you are able to manage just on brain X-ray. MRI we have now in the country, I think a good number of hospitals have MRI. And we are taking advantage, especially when we want to do angiographic MRI. So you can use the MRI machine to really show you the blood vessels and how they have been affected by the lesion intracranial. So, and I think we're on the line. I thank the presenter. Very good. Already, this is the first presentation, but the confidence you have shown. Can we clap for this speaker too? Over to the confidence. By the time you are reaching your final year in MBCHB, you will be very good speakers. The dean is here. I'm happy she has explained to you how to apply anatomy and you see the regions, the anatomical application. Have you seen what I've done, Professor Ethan? I listened to her. All the systems were touched, more or less. Central nervous system, respiratory system, that's where the dean was commenting. Cardiovascular system was commented upon. That's when this time, I'm so happy. You even showed the appendix. So this appendix is very difficult to diagnose. Most of the time, just a clinical diagnosis. You will see when you are palpating McBurney's point, and I'm going to tell you what is McBurney's point. How will it determine it? If there's a tetanus and galley, it's a clinical diagnosis for acute appendicitis. And when you open, you must see the appendix, understand the vasculotomy organ, not supply to the appendix. If the appendicular artery is even branching up to the teeth, it's unlikely to be gangrenous because blood supply. If it's a single appendicular artery, it enters towards the base in the back of the appendix. Most of them will be gangrenous because the swelling is the count of the blood supply. So once appendicitis will do very common example of appendicitis. Build on that, then the fact. You should know, I think some of you mentioned the kidneys and what else. That is very, you should know which system we are in that. Endocrine system, then musculoskeletal. I was so excited. Concentrate. The skin is extremely important. When someone says the largest organ, The skin, that's where we lose it when a patient is unconscious and we don't turn to our they develop pressure sore. And the word with the pressure sore is a very unfortunate word. It's poor care, end up with pressure sore. So I want you to understand the skin. Where a clinician will say, turn this patient to our we are preventing the pressure sore. So we have gone all the major 7 systems of the body. On anatomy, very soon we shall be hearing what the tissues are doing. What are the lungs doing? What is the heart doing? What is the brain doing? Physiology is coming in very soon, and I think we'll be hearing the functional aspect of the body. So build on this knowledge. And I would like you to concentrate. Professor, this is very good. Maintain this quality. And it means any Tuesday, the grand round must be done for pre-clinicals every Tuesday. That would be very good. Assistant Dean of Pre-Clinical, you are here. Can you read for Dr. Twizzer's time? Wow, but what's one department of preparing something like this? Those that started with anatomy, very soon of physiology, but the team is here, the children's class with assistant dean pre-clinical, which are organizing this presentation every week. May God bless our efforts in happiness. Thank you.
Excellent. Thank you. Thank you, Professor Lambert. Unfortunately, we have now met the hour of 14, but I would like to quickly invite closing remarks. I shall begin with our presenters team. Presenters, the floor is yours to give your closing remarks.
All right, so we are very grateful for this opportunity that we have been provided from the school board and also for the viewers who gave us a chance to come and witness this event. For it's not every day we have access to such. So from all my fellow presenters, I myself to say thank you to all, and we hope to see you again next time for another presentation. Thank you.
Well done, team. Excellent work. I would like to invite closing remarks from either our dean or our HOD.
Thank you so much for such an opportunity. I think this is a platform for the basic sciences to shine. There's so much, not only the classroom, but research that is going on that we could use this platform to just spread a spotlight on the basic science part of things. And this will also help you as students to engage in what is coming next, which are the clinicals. So once you learn to appreciate the science and learn to tap in on what is so nice about these sciences, then you get to appreciate the patient that you will be servicing. Thank you for this opportunity and have a great day.
Excellent. Thank you. Thank you. Before we move to our professorial team, once again, I'd like to invite our moderator, Professor Oberton. Closing remarks.
Thank you. Thank you once again. We're excited to have this opportunity, and we promise we'll do better next time. As we expect to see you come next week. Thank you.
Thank you, Professor. You have already set the bar high, so it will only get better from here. Thank you. Professor Lambert, the floor is yours.
I just want to say thank you, Professor here. And you don't do as much candidate, I say thank you. But I want to emphasize one point. Please don't waste sleeping one day. Madam Shinondo, Mr. Zhu, let's chase up for presentations. And if there's one area where they are not presenting, then you say another thing. So we have said the Monday will be pre-May. Monday. Nigeria is good to pre-May. Tuesday is the pre-clinic. And you people attend, encourage your friends to attend. And the Wednesday is research. Professor, I think, make sure we don't lose only the research. The dean of pre-clinical mentioned the research as well. But we have a day on Wednesday for research. Thursday is the MBCHE. Listen to your senior, how they are presenting from the clinical side. Friday is for nursing, physiotherapy, physiotherapy, bring up the learning student the country. You should see how this one in weekend. I think that is the effect here. Friday we close and put the phone back. Returning Monday, Friday. When you have done, please attend to this presentation. Because we want to be really the then we start next when we graduate. And we start from year one. Pre-med, pre-clinical, we plan on how to the end. When you graduate, you'll be completely changed the health wake up. Knowledge you have, skills you have, but my idea is good attitude, good character, and good behavior. You learn how to dress, very smart, right course, badges of affection on your pocket. We salute this. Start walking, talking like a doctor. Thank you very much.
Thank you. Thank you, Professor Lambert. And with that, we've come to the end of the inaugural preclinical, or rather virtual preclinical research, preclinical presentation. Once again, well done, team, and to all of those involved. Take note that these will be taking place every Tuesday. Every Tuesday. The next topics will be communicated later. Thank you for all of those who have attended. Enjoy the rest of your day.